So let's continue with the discussion of air pollution and also get into a bit about what kind of policies can be effective in reducing the impacts. Obviously, reducing air pollution is the most effective way of doing things, but considering we are trapped in the system where pretty much everything we do has some impact on air pollution, we are not even talking about water and food, etc. But the overview of continuing the discussion, overview of ways in which air pollution affects our bodies, grouped by organ systems. Several key aspects are highlighted here, and more details can be found in the review of a paper produced as reference here. This report is not only great but has some incredibly good references, as you can expect. I think close to 100. You can follow up on them as well. Okay, impacts of pollution. Of course, lungs. We talked about COPD and other upper respiratory diseases and asthma and so on. Cardiovascular system, we talked about heart rhythm, loss of blood vessels, ability to control blood flow and so on. Metabolism, incidence of diabetes continues to increase in across the world, and we always think it's obesity, lack of exercise, and maybe pre-processed foods and processed foods and so on and so forth. But what is the role of pollution in the metabolic disorders that people are suffering more and more across the world? So having diabetes also increases the risk of developing other conditions such as heart and kidney disease, which are also exacerbated by air pollution directly. So some multiple risk risk multiplier air pollution is, right? Renal, both short and long term exposure to air pollution can impair kidney function through decreasing the rate by which blood is filtered by the kidney, or an imbalance in the substances that pass into the urine, right? Long-term exposure to air pollution is linked to chronic kidney disease, CKD, and CKD is common in the UK, but I'm sure also across the world. So while the renal effects of air pollution are not fully established, the burden on health could be considerable, and it's a risk factor, so we don't need to wait for proof to do something about it, right? Liver, emerging evidence suggests that exposure to air pollution causes inflammation of the liver and leads to the release of markers of liver injury into the blood, so they can see that. And associations are also emerging with non-alcoholic fatty liver disease that is most common chronic liver disease in the Western countries. Gastrointestinal system, air pollution is associated with changes to the microbiome of the gut, ulcers and gastritis, as well as the inflammatory bowel disease and Crohn's disease as well. You can read up what Crohn's disease is. All these are related to the tummy, but basically if you can find PM 2.5 not only in the lungs but also in the bloodstream, going into the gut, into the across the membrane into the bloodstream and all the way to the brain, you know that it's hammering everything in the gastrointestinal system. Bones, air pollution has been linked to a weakening of the bones through osteoporosis, which makes the bones more prone to fracture, and skin. Long-term exposure to air pollution is linked to the aging of the skin and conditions linked to allergic processes such as urticaria and infection such as acne. Okay, here are just brief numbers again. Globally, air pollution is responsible for 6.7 million premature deaths. Ambient PM 2.5 is estimated to cause 4.2 million early deaths, of which 40 to 60% are due to cardiovascular disease. So in terms of deaths due to natural hazards versus air pollution, this just tells you that cardiovascular diseases kill overall more than 30% of the total deaths, and these things are just exacerbating those pre-existing conditions or causing these problems. This equates to 1.9 million deaths from ischemic heart disease and 900,000 from stroke. This means that greater than 20% of all cardiovascular deaths are caused by air pollution. It's very serious numbers. Air pollution causes over 11,000 premature deaths from cardiovascular diseases in the UK, but you can look up the numbers in other countries as well. Continuing with the impacts of air pollution. Cancers, there is plenty of evidence that many pollutants that generate reactive oxygen free radicals that can damage DNA and can cause cellular trigger for drivers or trigger cellular level cancer response. In addition, air pollution promotes tumors by triggering existing DNA mutations, so it just makes things worse as well. And there is other data that I won't read here, but let's say if we can pick something. The mechanistic basis for the association of genetic mutation, DNA damage, etc. Have been proposed by Hill and colleagues. You can look up the reference, who found a significant association between PM 2.5 concentrations and the incidence of lung cancer. So we already mentioned that several times. Modeling this association in the mouse suggests that it's the capacity of particulate matter to induce inflammation rather than direct effects on DNA that underlies this association. So cancer always scares people, and it's very easy to imagine that lungs are directly exposed to pollution, right? I don't know why I'm fumbling so many words. Susceptibility to infection, although the Royal College of Physicians 2016 report did not highlight the effect of outdoor air pollution on susceptibility to infection. There's clear epidemiological and mechanistic evidence that air pollution increases infection risk. And which means overall it will weaken your immune system. So COVID-19, of course, was heavily affected. So there is a preconditioned weakening of the respiratory system, and then when you have something like COVID-19 comes along, you can expect that it's going to have increased susceptibility to infection as well. Similarly, you have SARS-CoV-2, bird flu, and anything like pneumonia or exposure to not only PM 2.5 but PM 10 and NO2, especially if you're also a smoker. So for new onset and repeated lower airway infections, there is paper showing how strong associations exist between long-term exposure to all three outdoor air pollutants, i.e. PM 2.5, PM 10 and NO2. Okay, we don't need a lot of data, we just need to reduce exposure however it is done and to reduce the pollution itself, right? So relative risk versus PM 2.5 concentrations 0, 5, 10 and 15. As I said, I think WHO standard is somewhere here, or actually WHO guideline is here at 5 micrograms per meter cube, but you can see that UK's annual average is somewhere here over 7 to 10, and 2040 target for England is at 10 in terms of the relative risk. So you have to see how they are defining the risk in this case, but just keep in mind that the risk increases as PM 2.5 increases, and with ever increasing deforestation, industrial activities, number of vehicles, etc., and still relying on fossil fuels including coal, you obviously have air pollution still increasing, right? Here about air pollution. Air pollution has negative impacts on the population's health and the environment, and is bad for the economy. So we're repeating the obvious, but it's still worth repeating. Air pollution is harmful to everyone, but disproportionately affects the most vulnerable groups in the society, like kids, infants and elderly and women. Tackling air pollution equitably would decrease health inequalities, and you can see the numbers here. In 2023, people living in the 20% more deprived areas experienced 8% higher PM 2.5 concentrations than those in the 20% least deprived, which makes sense. Indoor air quality must be considered as well. People spend 80 to 90% of their time indoors, especially women in many countries, yet there are few standards for pollutant concentrations in indoor air. We are always talking about air quality index and PM 2.5 levels for outdoors, but what about indoors? In 2019, air pollution was estimated to have an economic cost of 27 billion pounds per year in core healthcare costs, but this number has to be done for each county, city, country, and so on. I mentioned 30 billion or so for asthma itself in the US. Hay fever also is another thing that costs people lots of headaches as well as lots of money to the system. Net zero policies are an opportunity to deliver core benefits that improve air quality and address climate change, but net zero is still a kind of a dream that we all have to drive towards, right? Infographic detailing the main sources of poor indoor air quality and the pathways to reducing exposures. I have a lot of podcasts on net zero pathways, and all the issues associated with them and so on that you can look up. Okay, I also have a full course on climate and health that you can follow up on. So indoor air pollution, there are bioaerosols and indoor emissions like moisture, inorganic volatile VOCs, volatile organic carbon, right? Outdoor infiltration, obviously, and reducing sources, identifying causes of damp. In live indoor bioaerosols can also include live microbes, viruses, bacteria, and fungi, and biological VOCs, allergens like dust mites and pet dander, and so on and so forth. Okay, reducing sources and includes a few steps like identifying causes of damp and humidity, selection of building materials, paints, furnishings, etc., reducing or replacing the cleaning and personal care products, replacing solid fuel, oil and gas heating and cooking sources with electric, managing water systems to avoid microbial growth, insulating or wearing a mask when sick, and so on. Some are very easy, no regret decisions, but some are not so easy and require financial assistance maybe, or government regulations to help people. Managing pathways, so this is about quality of housing. Timely maintenance of buildings, enabling effective building ventilation, using local ventilation devices such as bathroom extractors and cooker hoods, vacuuming carpets, using air cleaners, and so on. Protecting people, driving up building standards and guidelines, reducing the density of people in a space, moving vulnerable people to different locations, carrying out pollutant generating activities at times of lower occupancy, and using masks. So moving vulnerable people to different locations, that's a very disruptive kind of thing as well. It's not easy to move people just behaviorally speaking, but also it can be very expensive. Who's going to pay for it, right? So it's not an easy problem. Schematic showing some of the main features that atmospheric dispersion models will attempt to simulate in terms of producing early warnings. So you have sources of emission, dispersion, processes of advection and transboundary pollution. You know, it's UK's pollution problem is not just UK's pollution problem. It could be coming all the way from the US or from other European countries, depending on the direction of winds. There is an evolving mixing height, so it depends on how the air gets ventilated and whether pollution gets dispersed faster or gets trapped and so on. So you can see here pollution getting trapped. So escaping from the mix layer matters. Here is where ventilation is happening. Chemical transformations happen in the atmosphere, which can be good or bad. There is dry deposition, so heavier particles can just fall out, or when there is rain, there is washout. So when monsoons come, pollution is reduced greatly over parts of India, for example. So you have wet phase reactions as well before a rain out happens. So remember things like acid rain, which were resulting from sulfates, etc. Right? That's a very fast run through what models do, but now AI is playing more and more role in doing this as well. AI is an umbrella term that includes several embedded or nested concepts such as machine learning, deep learning, and generative artificial intelligence. I have discussed these concepts elsewhere in the climate course, for example, that you can look up. Limit values encourage action, but continuous improvement needs to be embedded into air quality policy. Effective urban planning and space design can reduce air pollution, and the government needs to set pathways towards WHO's 2021 air quality guidelines and regularly review progress to make sure that actually we are moving in the right direction and money is being spent effectively and efficiently. Air quality must be seen as a public health issue, not just an environmental one. This is already fairly obvious, and yet the explicit link has to be made, right? So tackling air pollution sources should be prioritized over individual interventions. Policies need to be developed with public engagement so that co-development always makes them more acceptable, especially if some kind of a intervention is involved, like drive less, take public transportation, etc. The government should deliver a coordinated public health clean air campaign. Policy development must respond to new evidence on its health harms and impacts, including on brain health and dementia. Health professionals must take greater ownership of this public health challenge, speak about it with their patients, and advocate for cleaner air. If people know the impacts on brain health and dementia, then maybe they will pay more attention to policies that require them to contribute less as well. Coming closer to the end, policy agenda for mitigating the impact of air pollution on brain and mental health. Policy needs to focus on how the cities and towns in which we live impact the air we breathe. Strategies need to focus on the air quality of highly vulnerable groups such as older people and infants, pregnant women. Scientists need to build historical models of air quality going back to the 1970s so that we can do retrospective analysis of health impacts to explain the health outcomes from the past, to make better connections and better early warnings. More research is needed on indoor air pollution. We spend 80% of our time indoors, and we need greater understanding of how air pollution impacts brain health. Air quality policies need to focus on prenatal care, childhood and aging, the critical periods in life where they can have the biggest impact. Governments and foundations need to provide more funding in this area. We need to bring public attention to this whole air pollution and health issue. Schools and universities, as well as healthcare providers, need to educate children and adults about the effects of air pollution. It sounds like we already know everything, and yet most people probably don't even pay attention. Existing campaigns on brain health, dementia, and climate change need to link them to air quality. People need access to apps, monitors to assess quality of the air they breathe. So, can you imagine having just an app on your smartphone that will let you look at the air quality you are going to experience as you go out, so that you can at least take some precautions. If you are highly vulnerable or asthmatic, you could maybe carry a mask, or you could make sure that you don't forget your inhaler and so on, or maybe allergies and antihistamines, etc. Scientists and governments need to better evaluate air pollution policies to improve brain and mental health. Everyone from citizens to businesses need to be involved in developing and implementing policy, but also playing their role in reducing pollution. Research needs to show how air quality impacts on climate change and other environmental health issues, how air quality impacts economic change and other environmental health issues. Aerosols are studied widely. We don't have a very good handle exactly on all the details of direct and indirect impacts, but more and more progress is being made. Policy needs to address how air pollution may worsen the health of people with dementia and other mental health issues. So that's a special care issue where we have to make sure that those people are protected because they may not be able to take care of themselves, right? Is a health evidence-based air quality guideline, for example, from WHO, reasonable for adoption as a regulatory standard? Is attainment technically feasible? No, then you have a set of actions. Yes, then you have a set of actions, but you have feedbacks as well. So let's go down here. No accommodation for non-controllable pollution. Discount non-controllable pollution such as wildfires, accidents, etc. Grant, so coming from above, so let's go down here. Set differential standards taking account of regional local differences. Set less ambitious standard accounting for feasibility if it's not technically feasible. Adopt guidelines irrespective of feasibility, whether it's technically feasible or not. You can impose certain regulations. Perpetual breach of the law can happen. So here broadly the pathways taken by Canada's air quality management system can lead to regular review of ambition, so that you are tracking all these cascades. If things are feasible, then obviously are the interventions needed socially, politically, economically feasible? No, then it leads to certain actions. And yes, so broadly the pathway taken in the UK: environmental targets regulation for PM 2.5, risks of legal action and of air quality standards being ignored or considered unreasonable, and so on. But basically I'm being a bit lazy here. It's many things are obvious in terms of, let's say, we have to reduce pollutants, air pollution, and protect people from being exposed indoor and outdoor. But what is technically feasible? London tries things like congestion pricing. You have to pay a special fee to drive into the city, etc. But many places you cannot even implement it. It's politically not possible, right? So it depends on where you are and how willing people are to pay for it, how willing politicians are to implement regulations, and so on. And then there may be just technical feasibility issues as well. If you're driving on the road and the tires are just wearing out and putting out PM 2.5, then the the pathway to reducing that is a longer one, right? Advantages and disadvantages of different conceptual approaches to air pollution standards. So I won't read all of them, but just let's look at the types of approaches. Nationally applicable standard for maximum concentrations, such as national limit values, national population exposure reduction targets, regional standards or targets for maximum concentrations, local standards or targets for concentrations. So that's it. And let's read one. If you want to have regional standards or targets for maximum concentrations, the advantages are that this allows different levels of ambition based on area specific situations and sources, so it doesn't have to be one size fits all. Delivers action in areas of poorest air quality as well as requiring progress in other areas, so its local control is always critical. Can be used to support continuous improvement and non-regression, so you don't go back, and easy to communicate because it makes sense to people that it relates to what they are experiencing. The underlying concept is well understood by public groups and local authorities. So decentralized controls are always much better than national guidelines. Disadvantages: perception of geographical inequality, need to determine multiple values that are suitable for different geographic situations rather than a single national value. It's onerous but should be still done. Regional geographic air quality standards may not align to units of local or regional governments. Well, obviously there are always barriers to implementation, but nonetheless. Looking at an example of Canadian ambient air quality standard management levels for PM 2.5 and examples of associated actions that are required. So air quality management level red, orange, yellow and green, which is mostly what other places have as well. So here levels of annual PM 2.5 in micrograms per meter cube. So if you exceed those on any day, then you get these kind of alerts. Green, if it's 4 micrograms per meter cube, that is safe. So that's the WHO standard of below the WHO standard of 5 micrograms per meter cube. You get a yellow, so 4.1 to 6.4, 6.5 to 8.8, it goes to orange, and it's greater than 8.8. It represents that this represents areas that are above the air quality standard. So what are the actions? Let's look at the top one. Development and implementation of a comprehensive air zone management plan, including short, medium and long-term milestones and targets. Compile emission inventory for air zone. Engage local stakeholders to make them aware that they are in this situation and they also have a role to play in taking care of themselves. Development and implementation of a comprehensive air zone management plan in the orange zone. Compile emission inventory, of course, and engage local stakeholders. For yellow, development and implementation of an air zone management plan and compile emission inventory for air zone. It may not require stakeholder engagement, but basic monitoring for trends has to continue even if the air quality is safe and green. Okay, so finally, the close collaboration between urban planning, environment, climate action and health is essential for a transitional and healthy change. Okay, this comes from this paper you can look up. So evidence-based decisions, institutional arrangements, political leadership is always critical because this often includes expenses, budget allocations, which means it will not happen without political will and leadership, and stakeholders and citizens have to be engaged because co-developing solutions and policies and restrictions, constraints and barriers, or not barriers but compliances always needs that they are aware and are okay with it, or at least they are aware so that they don't complain that they were surprised by it. So urban planning, climate action, health, environmental quality all together. Okay, so finally 10 top tips for clean air communication. Keep your message simple and repeat it often. Focus on health impacts relevant to your patients, very specifically tailored to them. Understand your local context. Use clear and easy to understand language. Don't use jargon. Empower people to make good decisions about their own health. Talk about the health benefits of clean air so they can also fight for it. Tell stories to connect with people. This is a very general trick for communication, effective communication. Avoid polarizing language. So don't say they are doing bad thing and you are suffering, etc. Talk about air pollution during high air pollution events so that people can see outside and be convinced quickly that yes, it's a problem. Don't debate the science. Science is settled and understood, so no, don't get into debates about the science. 3 levels at which clinicians can communicate the benefits of clean air. Communicating the benefits: personal, professional and political. So health professionals are seen as role models, so they have legitimacy, credibility and their message has to be salient. So by educating themselves and following principles that reduce air pollution emissions and exposure, personal communication can be encouraging others to follow suit, so peer pressure can work as well. Professionally, in our clinical practice, we need to make air pollution conversation business as usual. This includes talking to our patients and colleagues about air pollution all the time, especially if they have breathing problems and if they are pregnant and so on. Politically, we are consistently among the most trusted professions as physicians. We should use this power to advocate for air quality to be seen as a health issue and for policies that reduce air pollution at local, regional and national levels, and they can be the leaders in asking people to use early warning systems and apps and so on, if that helps the patients with their health as well. So this one is just a tiny bit longer than the first one, but it's good that I split it because just doing it in one would be either rushed or it would be too long either way. So let's meet in the next topic. Okay.